postpartum depression and anxiety. Imagine you've just given birth to your first child. You expected to feel an overwhelming sense of joy and happiness, but instead, you feel a deep sense of sadness and fear. You find yourself unable to enjoy your baby, and you feel like you're failing as a mother. You're not alone. Millions of women around the world experience postpartum depression and anxiety every year. In fact, research suggests that up to 1 in 7 women may experience PDA after giving birth. It's a serious condition that can have a significant impact on a mother's life and the lives of those around her. Childbirth is a unique experience for every mother. For many, it is an overwhelming and life-changing experience that brings immense joy and fulfillment. However, for some mothers, it can lead to a condition called postpartum depression and anxiety. PI. Postpartum depression and anxiety can cause feelings of sadness, hopelessness, and fear that can be difficult to cope with. In this video, we will explore the topic of postpartum depression and anxiety. We will discuss what it is, what causes it, and what treatments are available. We will also hear from mothers who have experienced ITU and learn about their experiences. By the end of this video, you will have a better understanding of this condition and how to support those who may be struggling with it. Part 1. What is postpartum depression and anxiety? Postpartum depression and anxiety are mood disorders that occur after childbirth. PDA can develop anytime within the first year after giving birth, but most commonly, it occurs within the first few weeks or months after delivery. Symptoms of PDA can include feelings of sadness, hopelessness, and emptiness, anxiety and panic attacks, difficulty bonding with the baby, feelings of guilt, shame, and worthlessness, insomnia or excessive sleeping, loss of interest in activities that were once enjoyable, changes in appetite or weight, physical symptoms such as headaches or stomach problems. These symptoms can have a significant impact on a mother's ability to care for her baby and can also affect her relationships with her partner, family, and friends. Part 2. What causes postpartum depression and anxiety? The exact cause of postpartum depression and anxiety is unknown, but there are several factors that can increase the risk of developing PTDUA, including hormonal changes. During pregnancy, a woman's body goes through significant hormonal changes, and after childbirth, hormone levels drop rapidly. This hormonal shift can trigger mood swings and depression, genetic predisposition. Women with a family history of depression or anxiety are more likely to develop PTDUA. Life stressors. Women who experience significant stress during pregnancy or after childbirth, such as financial difficulties or relationship problems, are at a higher risk of developing PTDUA. Birth trauma. Women who experience a traumatic birth, such as a long and difficult labor or an emergency C-section, may be at a higher risk of developing PTDUA. Part 3. Treatment options for postpartum depression and anxiety. Postpartum depression and anxiety are treatable conditions. The most common treatments include therapy. Therapy such as cognitive, behavioral therapy can help women to manage their symptoms and develop coping skills. Therapy can be done individually or in a group setting. Medications. Antidepressant medications can be effective in treating PTDUA. However, it's important to note that not all medications are safe to take while breastfeeding, so women should consult with their doctor before starting any medication. Support groups. Support groups can provide a safe and supportive environment for women to share their experiences and receive emotional support from others who have gone through similar experiences. It's important to note that treatment may look different for each individual, and it may take time to find the right combination of therapies that work best for each person. Women should also feel comfortable discussing their treatment options with their healthcare provider and seeking out additional resources if needed. Postpartum depression and anxiety can be a